Welcome back. If you or your loved one is part of the baby boomer generation, you aren't alone in wondering about your future. Leanne with the Montana Department of Public Health and Human Services is still with us. We're going to keep talking about this baby boomer generation. So it seems like there are many options available for older adults to choose from, especially when it comes to living. You mentioned that right before the break. Is assisted living the same as communities for retirees or that 55 plus group?
No.
Okay.
So they may have some similarities, but typically the 55 plus or age restricted communities or senior housing apartments are geared for active adults who enjoy healthy, independent living. So most of those communities offer different amenities. Some offer transportation, some have gyms, some have, they range in what they provide. And while some have healthcare services on site, they're not licensed facilities, and
Okay.
Senior apartments are kind of the same. They may offer some services like transportation or bus pickups or things like that, but they're much, much different than assisted living.
Okay, so what does an assisted living facility offer? Can you talk a little bit about that then?
So assisted living is designed to provide the level of service that you need to stay as independent as possible. However, when you go into an assisted living facility, there's an assessment that's done, and that determines your level of need. And so everybody in assisted living generally needs some level of assistance, whether it's, just help with medication management or just some help with bathing or just somebody to help provide security for them. Most are apartment style, so they're kind of similar to some of those other communities in that way. But there's also a lot of small home-like assisted livings that are licensed in the state of Montana, ranging from 4 beds to maybe 10, just kind of small home-like. And then we have some that have 200 and 300 beds. So
Wow.
They really range in what that assisted living facility looks like.
Comparing assisted living with nursing homes then, how are they alike or different?
Right, so typically, as I said, assisted living is just to provide the level of care that you need, and generally that's a minimal level of care. It's not, full assistance with your activities of daily living or those kind of things. Nursing homes, on the other hand, are designed to provide skilled nursing care to those that require a higher level of care and require 24-hour skilled nursing on site. So they have doctors and nurses that guide the treatment programs and the medical monitoring. They have nurses and certified nurses assistants that work round the clock to help the, bathing, feeding, dressing, grooming, those kind of things. And assisted living residents are generally more independent than that and don't require that level of skilled nursing, at least for long periods of time.
Okay. Are there other options when it comes to senior living?
Yeah, so I think I talked about this a little bit earlier. There's these continuing care retirement communities. So you may actually go into one of these communities as an independent in an independent apartment that is not licensed, or you don't receive any services. And then the next step would be a retirement. You'd move to the retirement part where you have laundry and a meal and some housekeeping. And then as your needs change, there can be assisted living, and then some even have nursing homes that are attached. So as your level of care changes, you don't have the drastic move of moving to a complete separate place, maybe just a different place within the same community.
How does a person assess that then? Where do they start to determine which home is right for them?
Right, so if you don't know, it would be a good idea to get, if you don't really know what exactly your needs are, or a lot of times people underestimate their needs.
Sure.
So you would want to go, maybe have an assessment by your doctor, or any assisted living facility has someone on staff that can do an assessment. And then you always want to consider the financial aspect. These things vary so greatly in cost, from just an apartment to having, a full assisted living slot, and then certainly a nursing home. But you'd want to visit a bunch of different facilities. You'd want to look online. You'd want to research. You could call the state. My office, we have an online web portal that shows the different facilities and different communities and what their track record is as far as deficient practices. And so you always want to get a clear picture of the cost and what kind of financial arrangements, because you don't want to move into some place and then not be able to afford it.
Sure.
Yeah.
And then once you determine which place might be right, or type of place might be right for you, if you go into that home or that facility, are there questions that you should be asking?
Sure. So you should always ask, I would say, for a copy of the contract. Every place has to have a contract for what they provide, what services they provide, and what the costs are, what the fees, what the limitations that are there. Can you participate in your own medical care? What kind of training and background checks are done on the staff? That's really important. And I think one thing that's really key is, what happens if my level of care changes? Do I have to move, or is this a place that I can stay?
And Leanne, you talked really briefly about the cost being important. We are just about out of time, but can you talk to that just a little bit more?
Sure. So assisted living, the average cost is about $3,500 to $4,000 a month for assisted living. Long-term care insurance does cover assisted living. Of course, you'd want to check with your policy, but there are some Medicaid funds available for assisted living slots, and the VA. And spouses usually get a discount on when they room together.
Okay. All right, great. Thank you so much for all your time and expertise. That's our show. Thank you so much for joining us today. We hope you'll come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.